Welcome back. Dr. Charles Walker joins us now from Precision Spine Care. If you feel like your body aches more and you have more soreness in the wintertime, you're not crazy. Apparently, it is a real thing. So thank you so much for stopping by here this morning.
Happy to be here. Thank you for having me.
Always a pleasure. So tell me about seasonal affective disorder. What is this?
Okay, seasonal affective disorder is actually just a subtype of major depressive disorder, which is what people sometimes refer to as clinical depression. Clinical depression is kind of the common cold of mental health. There's a lot of depression in the population, and in fact there's a lot of people going around with untreated depression. But seasonal affective disorder we're talking about today is a particular type of depression that's triggered by the changing of the seasons, and it's related to the shortening of the daylight period during time. So you know, here we are in Tyler, Texas. I say you know, seasonal affective disorder is a bigger problem in Boston than it is in Austin.
Yeah.
But in northern climates like Alaska, Canada, Scotland, Scandinavia, it's a huge mental health problem.
Yeah, because it's dark all the time.
Right, right. And it's just, the other thing, it's important to know that it is major depression. It's just as serious as any other case of major depression. It can range from mild to moderate to severe to extremely severe, but it can be treated as readily as depression too. People do not need to suffer depression unnecessarily. They just need to get it treated.
So first, what are some of the risk factors for this?
Yeah, okay. Well, certainly living in a northern latitude is a huge risk factor. But, you know, not everybody in northern latitude will come down with seasonal affective disorder. Usually they have some of the other risk factors for depression, which female gender is a risk factor. Females about 1.5 to 3 times more likely to become depressed than men. People may also have a family history of a lot of depression, which suggests they may have a genetic predisposition to depression, and then also people may have a personal history of childhood adverse circumstances and things like that that predisposes people to depression. So
then my question for you, doctor, is what treatments are available if somebody at home might be feeling like this applies to me?
Sure, okay. Well, first of all, I want to say that I don't think you ought to let Dr. Google do your diagnosis for you. I really think it's important to get a diagnosis from a medical provider or mental health provider, and so people should go to their primary care doctor or seek an appointment with someone that can give a correct clinical diagnosis. Depressive disorders can be mistaken or confused with other conditions that involve symptoms of depression. There are medical conditions that cause depression, so people need lab tests to run to see, for example, a thyroid disorder can cause people to be very depressed. Some people have depression that is really not major depression, but it's actually part of the depressive cycle of bipolar disorder. That's treated very differently than major depression. Some people actually just have sadness, or they have grief, things like that that are really just part of normal experience. And then sometimes there's medication substance issues involved, so you really need the medical piece to rule out these other things. There's not a lab test for depression, but there are lab tests to rule out some of the other things that could be behind the depressive symptoms, and it all changes what the treatment might be.
Thank you. We're running out of time, but real quick, if you want to show me what this is for.
Yeah, so for people who clearly have seasonal pattern to their affective disorder, and it's not due to other seasonal factors like seasonal unemployment or school or something like that, light therapy can actually help, and I can just turn that on briefly like that. Actually has various intensities. They can overwhelm your camera probably, but I'll turn that back off. But if their seasonal affective disorder is strictly that, and they don't have other depressive problems, Therapy Light, these are obtainable online at various retailers, exposure 20-60 minutes a day. Sometimes that can really help alleviate their depression. But I recommend getting a diagnosis from a medical or mental health provider so that they're sure they're on the right track.
Great information. Thank you so much for being here today.
Thank you for having me.